Hello, everyone. My name is Grace, and this is my presentation for our MSW 602 Social Problems and Social Welfare class. The topic I have chosen for this presentation is homelessness, specifically veteran homelessness throughout the United States. This presentation outlines, discusses, and explains my findings into homelessness with an emphasis on highlighting human rights, equity, and justice. Homelessness and poverty are major issues throughout the United States as the cost of living is constantly on the rise and resources are becoming more scarce and inaccessible. As we look through a lens of anti-racism, diversity, equity, and inclusion, it is important to note that homelessness is not geared for a specific group of people. Rather, it is ruthless and can affect anyone at any given time. As a part of basic life necessities, homelessness is a human rights issue relevant to equity and justice, as there are many non-governmental and governmental agencies actively fighting to end the homeless epidemic throughout the United States. In the U.S. Department of Housing and Urban Development's 2023 Annual Homelessness Assessment Report to Congress, roughly 653,100 people were homeless on a single night in 2023. Approximately 6.6% of these homeless individuals were veterans. Throughout this presentation, I will discuss what homelessness is, its leading causes, its impacts, and solutions and resources in order to combat homelessness. So, what exactly is homelessness? According to the Substance Abuse and Mental Health Services Administration's SOAR initiative, which is the Social Security Outreach, Access, and Recovery Initiative, homelessness is a condition classified as the following: individuals and families who lack regular, fixed, and adequate nighttime residence, such as an apartment or house. Examples of inadequate housing include emergency shelters, transitional housing facilities, tent camps, and extended stay hotels, and more. Homelessness is defined as individuals and families who are at risk for losing their houses within 14 days without newly identified housing and lack the necessary resources and support networks in order to identify permanent housing. Homelessness is also defined as unaccompanied youth aged 25 and younger, or families with children and youth who qualify under the Runaway Homeless Youth Act who have not had a lease or ownership interest within the last 60 days or more, and those who have experienced two or more moves within the last 60 days, those likely to remain unstably housed due to various disabilities or those experiencing employment barriers, and those seeking asylum from domestic violence situations with no other residence found and lack the necessary housing resources and support networks in order to identify and obtain permanent housing. What causes homelessness? Like many things, there is not one specific cause to homelessness. Rather, there are many causes to homelessness, such as income inequality and instability, lack of affordable and low income housing, unemployment and employment barriers, poverty, domestic violence situations, and mental illness and substance use disorders. Income barriers, such as inequality and instability, affect poverty rates and affordable housing, which can lead to homelessness as individuals and families within these communities are oftentimes unable to afford housing due to a lack of affordable or low income housing and related expenses such as utilities, healthcare, nutritional needs, and more. Unemployment and employment barriers are often factors that contribute to homelessness. For example, individuals with disabilities may be discriminated against or unable to obtain employment due to their disability, leading to barriers. Poverty can be understood in two ways. absolute and relative. Absolute poverty refers to a lack of the financial resources needed to meet basic needs like food, clothing, and shelter. In contrast, relative poverty considers an individual's economic status in comparison to others in society, defining poverty as falling below the prevailing standards of living within a specific context. A lack of financial resources to meet basic needs, such as shelter or housing, contributes to homelessness as a result of poverty. Domestic violence can lead to homelessness as victims frequently escape their abusers to ensure safety and survival. However, in their haste to flee, they often lack safe housing alternative, resulting in homelessness. Landlords may also evict or deny access to their housing units for victims of domestic violence from their homes because of strict zero tolerance for crime policies. Mental illness can hinder a person's daily functioning and their capacity to maintain social connections, which may ultimately lead to homelessness. The stress and health challenges that come with homelessness can worsen mental health issues and increase the risk of substance abuse in order to cope with said mental health issues. Moreover, the interplay of substance abuse and declining mental health creates additional barriers to overcoming homelessness. These interconnected issues of mental health disorders, substance use disorders, income and employment barriers, life events, and more highlights the importance of why addressing homelessness requires more than just providing housing or a singular solution. Individuals facing homelessness often need support to tackle both substance use and mental health issues, as well as other related challenges. Homelessness has a widespread impact across multiple domains, including an individual's physical health, mental health, and an impact on society as well. Homelessness heightens the risk of health issues, including diseases affecting the extremities and skin disorders, and it increases the likelihood of trauma, particularly from physical assault or rape. It also escalates a relatively minor health issue into a more serious condition. Other health problems commonly linked to homelessness include malnutrition, parasitic infections, dental and periodontal disease, degenerative joint disorders, sexually transmitted infections, liver cirrhosis due to alcoholism, and infectious hepatitis associated with intravenous drug use. Many homeless individuals often struggle with both mental illness and substance use disorders. Often, individuals will turn to drugs and or alcohol in order to self-medicate for their diagnosed or undiagnosed untreated mental illness. Individuals experiencing homelessness who face mental illness and substance misuse are much more likely to be admitted to psychiatric hospitals. The cost of these hospitalizations are covered by public funds, which impacts the community as a whole. Individuals experiencing homelessness create a significant burden on government resources and taxpayers, impacting the local economy. Due to their situations, homeless individuals tend to consume more public resources, resulting in expenses rather than generating income for the community, with taxpayer money often spent on incarceration costs. The homeless population faces longer jail times than other groups, partly due to laws targeting behaviors such as panhandling and loitering, leading to tensions between merchants and homeless individuals, as well as challenges for local governments and police departments. Homelessness is a significant human rights issue that impacts both children and adults. Homeless children often face challenges such as family violence, addiction, social isolation, behavioral problems, inconsistent education, and limited access to health care. as local communities recognize the need to support those in need. Many nonprofit organizations have stepped up their efforts to provide resources like soup kitchens and shelters, while the stigma surrounding homelessness fosters shame and isolation, making it difficult for individuals to seek help, leading to an us versus them mentality. During the U.S. Department of Housing and Urban Development's 2023 Point in Time Count, or PIT count, there were a total of 35,574 homeless veterans accounted for on a single night, which is a 7.4% increase from 2022. A PIT count is an annual count of sheltered and unsheltered people experiencing homelessness on a single night in January. Since 2010, the Department of Veteran Affairs, or the VA, launched its first Veteran Homeless Initiative, with data showing that veteran homelessness has decreased by almost 50% since 2010. Each year, the VA establishes and releases specific goals for each fiscal year and provides monthly data for its progress. On March 14th, 2024, the VA announced its 2024 fiscal year goals for preventing and ending veteran homelessness. Specifically, for VA fiscal year October 1st, 2023 through September 30th, 2024, the VA's homelessness goals were the following: to place at least 41,000 homeless veterans into permanent housing, to ensure that at least 95% of the veterans housed in 2023 do not return to homelessness during the fiscal year 2024, and engage with at least 40,000 unsheltered veterans to help them obtain housing and other wraparound services. As the VA's fiscal year just came to a close, they have released amazing data in their goal completion for 2024. In that, the VA and partnered organizations were able to permanently house 47,925 veterans, which represents 116.9% of the VA's goal. The VA ensured that 96% of veterans remain housed from 2023, and the VA and community organizations were able to engage with 42,064 unsheltered veterans, which represents 105.2% of 2024's goal. While the VA has a strong mission to decrease and end veteran homelessness, it shifted its focus in 2018 from ending veteran homelessness to preventing veteran suicides, while evidence suggests that the VA's homelessness services can also help reduce suicide rates. A 2015 survey revealed that veterans with a history of homelessness attempted suicide at rates over 5 times higher than those without experiencing homelessness, highlighting the importance of continued federal support for VA services that not only address homelessness, but may also help prevent veteran suicide through outreach efforts. While the government and community put solutions in place in order to tackle the homelessness situation with the United States, there are always areas for improvement. Point-in-time counts, or PIT counts, I believe, could theoretically be completed multiple times per year in order to maintain and observe the amount of homeless individuals, including veterans, on any given night throughout the year. However, this would require more funds, resources, and volunteers that organizations may or may not have. In a study conducted by Curtis Smith and Ernesto Castienda Tinoco, seeking to uncover the marginally housed They suggested that the PIT methodology primarily focuses on visible street homeless individuals and those in shelters, often overlooking the marginally housed population who live in cars or temporarily stay with family and friends. To address this gap, they replicated HUD's, or the U.S. Department of Housing and Urban Development's, PIT count by targeting the marginally housed, improving the counting process through extensive training for counters, and leveraging the personal networks of hundreds of counters to locate this hidden population. HUD's PIT results are submitted to Congress as official data for policy considerations. Marginally housed refers to those living in transitional living programs, living with relatives or friends, i.e., doubled up, and living in cheap hotels and motels or a single occupancy room units. Another area for improvement could be the increase of annual income limits for HUD in order for more individuals to be able to receive assistance. For example, in South Carolina, in 2024, the median income limit for a family of four throughout the state is $84,800. Depending on which county of residence, this income limit may change. In Charleston County, the median family income limit is $105,100. While organizations have established policies, procedures, and criteria in order for individuals to receive assistance from them, these policies and criteria could be reviewed in order to be more inclusive. For example, through my experience of working with a contracted facility through the VA's Healthcare for Homeless Veterans program, if a veteran were discharged for inappropriate behavior, such as failing a required random drug test, the veteran would have to wait a minimum of 3 months before re-engaging with the VA's homeless program. Rather than prohibiting veterans from re-engaging in their deserved resources for a minimum amount of time, the VA could put substance use treatment measures in place in order to prevent a veteran being placed back on the streets in an environment that provokes substance use rather than healing. Like many homelessness assistance programs, they are often built on the foundations of the Housing First model. The Housing First model was developed in North America in the 1990s to address the housing and treatment needs of chronically homeless individuals, many of whom struggled with mental health and substance use disorders. This model emphasizes that housing is a basic right and advocates for programs that prioritize the needs of individuals from their own perspectives. Its key features include providing immediate access to permanent subsidized housing without requiring prior treatment, participation, or sobriety, distinguishing it from earlier models that mandated a demonstration of housing readiness before offering permanent housing. Research on the Housing First model indicates that it leads to better housing outcomes for homeless adults in North America. While it may significantly reduce the need for inpatient and emergency healthcare services, according to research, its impact on clinical and social outcomes appears to be more limited. It is crucial to understand that homelessness is not just a status, but a chronic condition and a human rights issue affecting hundreds of thousands of people daily. Access to housing and shelter is a fundamental necessity for anyone to thrive in today's society. These individuals require substantial support that can be provided by both the government and the community. Only through collaborative efforts can we hope to address this pressing issue and create a lasting change. Thank you.